Good evening, everybody. I'm Dr. Rick Lehman in St. Louis at the U.S. Center for Sports Medicine, and we're going to talk about concussions tonight. And I just want our staff to introduce themselves. So we'll start with my buddy Bryan Anderson. Bryan.
Hey, everybody. Bryan Anderson. I am the team leader for CORA Physical Therapy's Active Tracks program, which is our sports medicine and community outreach division. I've been a certified athletic trainer since 2004 now.
Dr. McMarlin.
Hi, I'm Andrew McMarlin. I'm a sports medicine physician, original background in rural then inner city family medicine. Prior to my ortho sports fellowship, had been a long time ago a serious athlete, trying to still be somewhat of an athlete, and trying to keep up to date with concussion. Things change all the time, so it's exciting. Got into it when I was team physician for DC United, and had a few people who had to retire early. So it's kind of concussion management and is near and dear to my heart.
Dr. Upshaw.
So I was a pediatrician working in the pediatric emergency department for about 15 years, and also was had been an athlete, still try to be an athlete at Emory, and the Braves are also in the playoffs, I'd like to add. But and then went back and did a sports medicine fellowship, and joined Dr. McMarlin's practice, where I see both adults and kids, but obviously with my background in pediatrics, have a special interest in pediatric concussions.
That's awesome. Well, first of all, thank you for all joining us tonight. So Dr. Upshaw, you mentioned something pretty interesting, the sensitive brain, which I've not really heard before, but I love it, because I think you're right. I think people with mood disorders, learning disorders, history of migraines, depression, seem to linger. You think they just have, can they not heal as well? I mean, just for my personal edification, why do you think, because when athletes come in and they're on, you look at their meds and they're on Zoloft or something, you always, as a sports guy, I always say to myself, oh my gosh, here we go. And what, do you think they have some predisposition, or is it just a sensitivity? Or, I mean, it's very interesting you say that. Why is that?
Well, I don't think we know. Is it that people with depression, with migraines, are they sort of more hardwired to sense changes more, or are they just more in tune? They talk about females being more at risk, and there's been some studies where they talk about, well, they have smaller necks and that sort of thing. But then there's also been some that say they're just more honest and they're more likely to be forthcoming with their symptoms, which is sometimes what I adhere to. But I don't know that we really know the answer to that. But I do think, like, for example, I had one patient that was I had one patient that was an artist. Let's leave it at that. And I had a really hard time getting her recovered because she was just so sensitive to everything. So I don't know if we really know, but is it that they're hardwired? Is it they're more attuned, or is it probably a little bit of both?
Well, I think that's good information for everybody listening, to be a little bit on their A game when you see somebody like that. So I think that's very helpful. All right, Bryan, I'm going to ask you the hard question right here. Prevention. What do you do? You got somebody who's had a concussion. They're coming out. It's their junior year in high school football, junior year D1 college, and I've got things listed like protective headgear, genetic testing for Apolipoprotein E, community education. What can you do to help prevent that subsequent concussion, other than telling them to go play the piano instead of playing football?
Which is something I've done before, honestly, in my career. Maybe this isn't for you. This is 3 in a year. Maybe it's time for another sport. There's a lot of things you can do. I think education for the general public is a big one, right? So knowing signs and symptoms, not only coaches and for medical parents as well, so they can be informed and know kind of signs and symptoms and what to look for. Generally, And you're right, it's a tough question. I mean, we talk about, Dr. Upshaw talked about it a little bit. Obviously, physical therapy, we talk about keeping the neck nice and strong to kind of keep that motion down and hopefully keep that, you know, brain trauma down a little bit. Again, to keep subsequent concussions, I think the best thing you can do is make sure they're fully recovered from the first one. Make sure they're normal musculoskeletal so they can protect themselves. And then make sure that if we're talking about football, especially, make sure that equipment fits correctly, make sure that their techniques are good. The other thing I used to see kind of, and again, just in my experience, is I called them headhunters, or, you know, the guys that, you know, number 88 on the field, number 1 in your heart. And they're about 5'8", 145 pounds, and they're absolutely not afraid of anything. So the first guy's down the field trying to, you know, make the tackle on the kickoff, and kind of play with that reckless endangerment. So again, while we love that attitude in football, but, you know, again, making sure technique is correct and making sure those things. Again, I don't think there's really any way to absolutely mitigate all of it. I think we can do our best to give ourselves the best confidence to make sure that, you know, they don't happen, but I don't think there's really any way. I know we've seen a lot of new helmets come out that are supposed to deflect blows and do all this stuff. I haven't seen anything really backing that up, that they're that effective. So.
Thank you. So just a couple of very interesting topics. And I think everybody, you know, they ask these questions when they come in to my office. Dr. McMarlin, what is second impact syndrome? I mean, how does that work?
You know, so when you have your initial concussion, you have this injury to not just like one neuron in your brain. You have billions of different neurons that are affected, and so some of it can be at the cellular membrane level, where all the kind of biochemical processes are really disrupted, but they're also much more, it puts in a fragile state where you have this big influx of, and trying not to get too biochemical here, but you get this gigantic influx of calcium that goes into the cells, and you get the potassium leaving the cells. And initially you get a lot of glucose, but then it becomes really hard for sugar to get into the cells from that energy. But any additional injury at that point, you can lead to apoptosis or cell death, where you go from having an injury to now you have like a true, not just a trauma, but some permanent damage of cells in the brain. So if you have enough cells involved with that, so if you have enough of an impact where you're damaging a lot of cells and you get swelling in different parts of the brain, you can actually have herniation of the brain back toward the kind of the spinal cord, resulting in coma and death. And so that's the biggest thing, the most severe thing that we worry about. So kind of everyone's nightmare, but which it's pretty easy to put the fear into parents about that, but a little bit harder when you have a 17-year-old who thinks they're immortal, because they're not going to be the one who gets that. So it's obviously super important to get in really good history all the time, and knowing that, like every other patient and all of us, everybody lies to the doctor and to the therapist. And so you have to take the whole kind of clinical picture to see, is someone really getting better? When you go through a battery of tests, are they really better? Are they trying to, because all of us have been there. We want to get back to playing, but making sure that that we're cautious and conservative enough that they're protected without being, that's that tough fine line of making sure we're not overprotective so they lose a season unnecessarily. So it's hard. One thing, I think we probably get to it. One thing that I really make sure I tell parents and or if someone comes in with a car accident, a significant other, or if it's an elderly person with their kids, is just being aware that this is not something that you have an injury and then it's gone, it's gradually going to taper off. A lot of the time, these symptoms don't show up for 3, 4, 5, 6 days. We had a kid in our office a year ago who started getting rapid heart rate, and so bradycardia, so very rapid and then very slow heart rate 3 weeks after his injury. And so when he would have the slow heart rate, he would stand up and pass out. So this was something that was really new to me. But so there's just because you don't have a lot of symptoms like Saturday morning after the Friday night game, you have your kid wakes up Monday morning and they have a headache and nausea. It might not be the flu Monday morning. It may be, but none of us, it's very rarely do we think back that at 6 a.m. on a Monday, when your child has stomach pain, you're not thinking about the hit they took to their head on Friday. You're thinking stomach bug. So it's keeping a constant idea in the back of your head that almost any of these things can be a concussion symptom.
McMarlin, what's CTE? Hear all about,
Yeah.
hear about CTE and make a movie about CTE. Everybody comes in and they go, "What's CTE?" So if I don't know, I'm going to ask you.
Yeah, I know the name concussion's a lot sexier name for a movie than CTE. So it's a chronic traumatic encephalopathy, and I mean there's been ongoing lawsuits for the NFL, and really it's when you have enough damage where you're seeing not only permanent brain injury but some progressive injury where you're developing some of the symptoms of like Alzheimer's or some of the other different types of dementias at a young age. But it's not just dementia. There's also this cohort of depression and some psychoses and progressive loss of balance, or people really, like if you speak with someone's spouse, it's where someone is really becoming someone else, or they're over time. And it's not necessarily the people who had that really big concussion. So it's not necessarily Troy Aikman, who got knocked out a number of times and had big concussions that really interrupted big parts of the season. But it seemed to be probably more often for the people who have these repetitive and frequently really subconcussive events. So in the old days, back in the 40s, 50s, you'd call it the dementia pugilistica, where the boxers who were just getting punch drunk, punch over and over and over again with your head getting knocked back. But when you look at a football practice for like 7-year-olds, you see the guys on the line and they're getting whacked backwards 60 times, 70 times in a practice, starting from 6, 7, 8 years old. And the people who are doing that long term, and I know I think we're kind of picking on football, but this happens in a lot of sports. I mean, you get gymnasts who are kind of getting hit against the mat over and over again, wrestlers, lacrosse players, hockey players, which probably of all the sports, it probably has the highest per hour played incidence of concussion, but not trying to bring concussion in, but for those subconcussive events that accumulate over time, causing this permanent damage inside the brain. And it's scary. And it's really something that's really not diagnosable until you have a brain biopsy right now.
That was really good. So Dr. Upshaw, we talked just a little about 6 and 7-year-olds playing football, 10-year-olds playing football. Kind of explain the pediatric concussion. How does it differ in terms of incidence, severity, exam, etc.? How do we differentiate, or what are the differences, I guess, from a pediatric concussion as it relates to a good old garden variety sports concussion that we would see in a typical sports practice?
Well, I think for one thing, you'll find that the younger athletes, the younger children will have more difficulty expressing how they feel. So for example, a teenager, a college athlete will talk about, I'm in a fog, I can't concentrate. A 6-year-old, 7-year-old, 8-year-old will have more difficulty expressing that. So you have to be more attuned into, they just don't answer me as quickly, they're more sleepy. So you rely a lot more on the parental observation. One big difference is we know a lot less about it. we know less about the incidence, less about how to treat it. And then what I find one of the biggest challenges in our practice is testing them. So for example, on a teenager, when I'm testing them, I'll ask them to do serial sevens backwards or months of the year backwards. With a small child, I might ask them to do days of the week backwards, but sometimes they don't know their days of the week yet. And so then I'm having to kind of work with the parent, like, well, what do they know? Where are they? It's the balance exam is more difficult because they're just not as, physically efficient with their balance yet. And so they may still be working on those motor skills.
And in terms of treatment, does it take longer for a pediatric patient to get over concussion, or about the same time as an adult, or is there a variability?
Well, with adults, you have different motivators frequently. Dr. McMarlin was talking about the car accident. So if there's litigation involved or there's work involved, but if you just compare, young athletes to older athletes, and say high schoolers or collegiate athletes, the general thought is that it takes the younger children longer to recover.
Perfect. And Dr. McFarland, is there any difference in treatment, or maybe the future treatment of pediatric patients versus the conventional adult or college athlete that has a concussion?
No, Dr. Upshaw is absolutely right with as far as the having. You can have some difficulty. I don't want to quite equate it to veterinary medicine, but where you can't necessarily rely on the history as well with the child. I mean, part of the problem is for boys, brain really isn't fully, the central nervous system really isn't considered to be fully mature until about 24, 25. Some women would say never. Girls are really about 22. Sorry, girls would say about 22, where their central nervous system is fully developed, and you have all these connections that are made at a what's considered to be an adult mature level. And so, if you have someone who is really still creating new brain cells, creating all these different connections, it's just considered to likely that's one of the reasons why, that it's more of a fragile brain for the kids, where it's one of the few injuries that you get where you would expect to have a slower recovery when someone's 10 than when they're 30. But absolutely right about Dr. Upshaw was describing about the different motivations. Kids want to get better. Generally, athletes really want to get better. We definitely see an extended recovery when if someone's referred by a law firm, and it's not, and some of that's because people had a bigger injury and maybe it was a really terrible car accident, but I think there's enough data out there that the motivation is definitely can be a factor for reporting your symptoms, but also for doing the things that you need to do to get yourself better. As far as there's the research right now there's a lot of research going on for kids for trying to figure out if you do like the cervical colic prehab, so where you're really kind of training the motor function of the neck, having a good physical therapist or ATC working with you to strengthen, and kind of some of it's helping with your proprioception. May reduce the incidence of concussion, particularly with kids. One of the things that I really worry about, particularly with kids, is the post-concussion time frame, because the data is pretty good that our injuries, particularly like ACLs, are dramatically higher in the 6 months after concussion. And so whether that's someone's not actually 100% better, or they're out of shape, or what it is, but it's kind of more than double incident. I mean, I don't know if what you've seen in your practice, but really higher incidence of some of these big musculoskeletal injuries in the 6 months post-concussion. So I'm really trying to get them to buy into really doing good rehab and getting on board with the trainers, physical trainers and ATCs, to make sure that they have the tools they need not to get injured again.
Thank you. So in closing, I'm just going to ask everybody for anything we may have forgotten, didn't discuss, any pearls? And I'll lead off with you, Bryan. Give us any closing thoughts, any pearls, anything we should have discussed.
Yeah, one of the big things I've seen kind of practicing as an athletic trainer is kind of the psychosocial, and we touched on it a lot, but most of my experience has been with adolescent and high school aged athletes and how important that is to them. And, you know, I've worked at varying different levels in different schools and different socioeconomic backgrounds, and just understanding that, again, if we're taking this injured person and it's not necessarily like an ankle injury. You know, with an ankle injury with crutches, you can still get around and live a fairly normal life. So we're taking these kids and removing them from all their support groups, removing them from all their friends and all the things that they love, has a very traumatic psychological effect on them. So to me, kind of doing little things, obviously if symptoms allow it, but letting them maybe sit on the sidelines for a little bit and watch their practice, not necessarily be a part of it, but just kind of be around. You know, Dr. McMarlin talked about it, you know, letting them get back that slow grade back into schoolwork and kind of into normal life. And the way we like to call that is just, we say everybody has a battery, and with a concussion, you have like a really old cell phone battery that needs to be charged a lot. So you may be able to do, you know, an hour's worth of something, and then you have to rest and recharge your battery, and then maybe you can do a little bit more. But again, I feel like that's the biggest thing that people, when I lecture on concussions and we teach our course in CORA, that's the biggest thing that people seem to not think about is that aspect, the kind of social and the psychological aspect.
Thank you. Closing thoughts, Dr. McMarlin.
You know, I feel it's really best treated with a team approach. It's the patient is obviously gonna have to take responsibility for a lot of the different types of recommendations and activities, but you really need to get parental buy-in if it's a child. Spousal help, particularly if someone has a lot of cognitive issues. If they're in school, really making sure that the teachers and guidance counselors, principal are on your side and the student side rather than on opponents. So really making sure they understand that there's going to be need for accommodation, and it may not just be a few days. So making sure that there's an idea that this is individualized, and sometimes it's a few days, sometimes it's a few months, to really make sure that you're getting that athlete, that patient back to 100%.
Thank you. Dr. Upshaw, closing comments, thoughts?
So piggyback on what they were saying, first of all, I completely agree with Bryan. Having an athlete removed from their identity as an athlete is very difficult. So if they can get back to practice and just watch or just go out for pizza with a team, that's huge. I think one of the things that frustrates me that I see in our community sometimes is these kids are told to stay home, don't go to school, don't exercise. When we know some subclinical exercise, I mean, don't go out and do sprints, but some subclinical exercise expedites recovery. And then I've had several very motivated kids, and if you take them out of school too long and they're falling behind, then you're just adding stress and worry about their grades on top of everything. So I try to get them back in as soon as I can, at least have them doing some sort of work to stay up and to mitigate that stress.
Great. Everybody, this was excellent, and I really appreciate it. CORA really appreciates it. You guys have a great night, and thank you.